And I'm here at Dr. Dadvand's office, a Beverly Hills plastic surgeon, giving the term nip-tuck a facelift with his revolutionary natural breast surgeries, specializing in men. It's called gynecomastia, a condition that creates excess breast tissue in both adolescent boys and men, resulting in the appearance of a more feminine chest.
Having gynecomastia takes an emotional toll on them, especially living in Southern California where it's such an active lifestyle and we have the beach and we have pools. A lot of guys feel very self-conscious, have low self-esteem, are in positions where they're not comfortable taking their shirts off, and it really does impact them. It's not unusual for me in a consultation when I ask the guy to take the shirt off to do the exam, I'm watching him take multiple layers off. And this could be in the middle of summer as well. And so you can really imagine how this can impact your daily living when you have to make all these decisions about something that most guys take for granted, and that's the appearance of your chest.
Gynecomastia is typically caused by a hormone imbalance, an endocrine disorder, or certain drug abuse like steroids that can affect one or both breasts, sometimes unevenly, and often cannot be fixed by medication or anything other than surgery. Dr. Dadvand has cornered the market on corrective, natural surgeries that help recontour and reshape the patient's chest for a more masculine look.
As a plastic surgeon who specializes in gynecomastia, the one thing I tell all of my patients is you can't do the same operation in everybody and get consistent results. So when I take a look at a guy's chest, I'm looking at four things. I'm looking at how much fatty tissue they have, how much breast tissue they have, whether they have loose skin, and what's their nipple position. And based on that combination of those four things, I determine the best technique. And so, for instance, if a guy has just excess breast tissue and not any fatty tissue, like say, for instance, bodybuilders in my practice or the guys who are really physically fit, then they don't need liposuction. And in fact, liposuction will not work in treating breast tissue. It doesn't remove it. You have to actually go in and cut it out. By the same token, if they have excess fatty tissue, then liposuction is the best treatment. And a lot of guys have a little bit of both. And so you do liposuction as well as removing the breast tissue. And you're kind of sculpting it.
His Instagram reads, Beverly Hills doctor without the Beverly Hills attitude. And it's Dr. Dadvand's cool attitude, passion, and dedication, not only to new patients, but to more difficult or less tackled cases that makes this statement true. His office sees a lot of revision gynecomastia surgeries, and Dr. Dadvand has also tackled surgeries involving younger men who have passed adolescence, but whom many other surgeons are usually hesitant to operate on because of their younger age.
Up to 60% of boys going through puberty get some form of gynecomastia. The one thing is, in most of them, over 97%, it goes away after 2 to 3 years. The ones that come in who've had it for longer, though, are candidates. And what I typically do is I do a hormone panel on them. And if it's normal, then they're absolutely candidates for surgery. And I think one of the things is that I want to stress as far as, someone who does a lot of the surgery is there's not a specific age minimum that you have to be to have this surgery.
And there's a reason Dr. Dadvand is a master in the art of plastic surgery. He also happens to be an artist.
So one of the things that drew me to plastic surgery was this kind of mix of science and art. And I was a fine arts major in college, and I concentrated in figure painting and figure sculpture. And I think that whether consciously or subconsciously led into my decision to become a plastic surgeon, it certainly helped. It's given me a much better eye than I think the average surgeon. I can verbalize things to people that they see might be off, and I can put them in terms that they can understand. But also in the operating room, when I look at a patient and when I'm operating on them, I look at it in 3 dimensions because that's what the human form is. And understanding that something that can look good in one aspect or in one view may look off in different views. And I kind of incorporate that in every aspect of my life, whether it's my surgery, my art when I'm doing it at home, or even the decoration of my office.
Recovery for this procedure typically ranges between 3 to 4 days before returning to work and 4 to 6 months before the patient starts to really settle into the desired results. And it is seeing his patient's happiness with the final product that Dr. Dadvand says gives him personal satisfaction.
So one of the most satisfying things for me as a surgeon who does gynecomastia surgery is seeing almost a transformation in my patients after surgery as compared to before. They come in and they have this self-confidence that they didn't have before. If they had pain going into it, the pain is relieved, which relieves a lot of the stress that they've had in their daily lives before. I've had patients cry. I've had patients tell me that now they can take their little daughter or their son to the beach and be active with them instead of just kind of sitting back. That's really, for me, that I always tell patients, if you can leave your house without thinking of your chest, I've done my job. And that emotional impact on their lives is very satisfying.
To find out more about gynecomastia, you can visit Dr. Dadvand's website at drdadvandplasticsurgery.com. Bringing you the best of California, I'm Conchita DeLugo with California Life.